Hi, everyone. Welcome to It's Sybil, a very special episode of It's Sybil. This is a part of our check in and check up for your health series. And I want to welcome our guest in today. First of all, you know him, you love him, and you can't get enough of him. That is our friend, comedian extraordinaire, Rudy Rush. Hey, Rudy.
What's up, Sib? How are you?
I'm good. How are you?
I'm great, actually. I'm doing pretty good, and I'm excited about today because we're talking about health. So I really am happy you guys asked me to be on the show
Absolutely.
because I got some
Absolutely.
questions.
We got questions about you too. And I want to welcome in our very special guest, neurologist, Dr. Kimberly J. Hatchett. Can we just call you Dr. Kim?
Sure. That's
Okay.
what most people do call me.
That's awesome. You are a neurologist, and neurology is the study of the nervous system. Does that include the brain study as well?
Oh, yes. So the brain and everything connected to the brain. So pretty much every system in the body I know a little bit about, but I know really how the brain affects it.
Awesome. Okay. So then we, you know what? I work with a lot of comedians like Rudy, so there's going to be a lot of questions about how their brain.
I was going to ask Dr. Kim how my mother brain works because she's gone right now. I was like, come on, Ma.
So we will get into that. Let's talk about just as we are talking about things that are in the news, which is what we like to do on It's Sybil and our You Need to Know newsletter as well. Talking about things that are going on, but also as it affects, because we want to talk about the brain and neurology, Dr. Kim's specialty, and you have a number of other passions that we'll also talk about, Dr. Kim. But in the news, and this is related to the brain and study, Supreme Court Justice retirement formally announced with Supreme Court Justice Stephen Breyer. Beyond the president's promise of nominating a Black woman, which I'm really excited about, Dr. Kim and Rudy. There are a lot of discussions about age and the mental acuity, specifically of the Justice Stephen Breyer, how smart and quick he is at the age of 83. And they kind of compare and contrast that to the president, who is a younger man of 78, and sometimes doesn't seem quite as quick and a little slower, if you will. But there are still questions about that. Can we talk a little bit about the brain and aging, especially as we're talking about this particular Supreme Court justice?
Okay. So when you think about aging, you want to think about normal aging, and then you have the outliers. So things like dementia. It comes to mind Alzheimer's disease, which is a form of dementia. People who have had head injuries, or we think about athletes like football players.
So that's where I wanted to go next. So yes, yeah.
So when you think about that, we should all have some form of slowing down and cognitive slowing, because as you age, your brain shrinks. It's called atrophy. And so that happens, normal. And so normal aging is going into a room and thinking, why did I come into this room? And then you think for a second, and then you're like, oh, I came in here for my keys. That's normal aging. Abnormal aging is, where are my keys? And then you find your keys in the freezer, and you're like, why are my keys in the freezer? I don't even remember doing that. So that's abnormal aging. But then you have to think about communication and how you communicate those things. So we all know that President Biden has admitted that he has a speech impediment, or he stutters. So he does talk slower, and it's probably because of a learned technique to get his words out without stuttering.
Got it.
Okay. So, from a cognitive standpoint, you wouldn't do a cognitive test on everyone. I don't do a cognitive test on all my patients. I do it on patients who who suspect that there's something wrong, or they're worried that something's wrong. But in normal conversation, I can tell if someone's cognitively normal or not, just by having a normal conversation with them.
Okay, just in terms of this, what do you think about Rudy?
No, you know what? My question to Dr. Kim was, what's wrong with having my keys in the freezer? I was like, that's normal, isn't it?
I guess it depends on if that's your place of putting them.
So you'll always remember where they are.
I guess if that's the case. Okay. Well.
Dr. Kim, I've always heard,
Mm.
and we've done a lot of work with a wonderful woman who is involved with the Black People in Alzheimer's, Black ALZ organization. And
Mhm.
one of the discussions that we had was it's not a question of not knowing where you place your keys, but when you pick your keys back up, knowing what they're used for.
Yeah.
That indicates to people that there is some form of dementia or some other disorder.
So when I talk to my patients about dementia, I kind of liken them to the movie, The Curious Case of Benjamin Buttons.
Oh, okay.
Okay, so if you remember that movie, it really exemplifies once an adult, twice a child. And so as he aged, of course, he became younger and younger. Newsflash, I'm giving the movie away. If you haven't seen it,
It's
it's
Listen,
too
if
20
late.
you
years
ain't
old.
see it
You're
yet, if
good.
you ain't see it by now,
It's too late. I'm going to tell
Right.
you. So the man ages backwards and he becomes demented. So he starts to go back to childlike things. He needs a walker. He needs to wear a diaper. He doesn't even remember how to feed himself. And that's the stages of dementia. It becomes where you are. I even tell some of my patients' spouses, like, let him take a nap or let her take a nap, like you would a 4 or 5 year old.
Hmm.
Let them take a nap. You might have to re-explain things over and over again like you would your 4 or 5 year old. And I think I'm close to it because I have a 5 and a 6 year old. I can explain to them, this is what I do for my kids, this is what you're going to have to do for your spouse because of
Mm.
what level of dementia that they're at. Does that make sense?
Sure.
Yeah.
Absolutely. Absolutely. Is it is there a point or an age perhaps where we start to look at things a little differently? Like a lot of people are just talking about Justice Breyer and what a smart man, just recently teaching himself to speak French while he's on the treadmill and, things like that. Is there an age where we should start to accept the changes in our brain and the atrophy and all of that?
I would say no. There's no age that you should accept it. And so you said a key thing that he was doing. He was on a treadmill listening to and trying to learn something. That's where exercise comes into play.
mm,
Because it allows that blood flow to continue to bathe your brain and allow those neurons to continue to work and fire the way that they're supposed to. Again, as you age, even myself, things that like fatigue,
Hmm.
not having a good diet, stress can cause you to have cognitive slowing, can cause you to have what are called brain farts, where you're like, what is happening here? Um, so those are outliers, but the actual dementia, that's not normal.
Hmm.
mm.
You and we can do things to keep ourselves sharp. Learning a new skill, like learning French, exercising, all of those things can play into allowing you to age well.
Now, Dr. Kim, my dad just passed away. He had dementia and Alzheimer's, and it's all the things you're saying. I mean, it rings true because the last 4 years of me taking care of him, he really got deeper into his dementia, and it's true. And let me ask you this question for people out there who may have family members: isn't retirement, even though we reached that goal of, listen, I've accomplished this and I can, save my money and vacation, but it does quicken the process because now you're not like the gentleman we just spoke about earlier. You're not going and exercising your brain or doing something that you're normally used to doing. You're more relaxed, so it can seep in a little quicker with the dementia.
Well, I think it depends on how you retire. So, like, my
Mm.
parents are two people that retired in their 50s. And they're now, my dad's 80, will be 82, and my mom's will be 70. My mom's 78. And when I see pictures of them when they were working and pictures of them now, they are like vibrant, different people. And I
Mm.
think it's because they had things to do. Like, my mom helped take care of my kids. My mom, hang out with her girlfriends. She was always doing something. My dad started volunteering and got in all these organizations to volunteer and do things in the community. So I think it's if you have a plan, and again, the exercise, they both actually got into really good shape once
Mm.
they retired,
Mm.
and started eating better and doing better, and their stress levels went away. So I think it just depends on the person. It depends on the individual, and it depends on the plan that you have when you retire.
Mhm.
Are there some diseases, brain, like Alzheimer's or other forms of dementia that are genetic?
There are. So Alzheimer's disease can be genetic, and people who have family members that have Alzheimer's disease have a higher likelihood of developing it later on in life. But they're the most, and we won't really, you don't really know that someone has Alzheimer's disease unless you do a brain biopsy upon
Mhm.
death. So that is something that on exam you say, okay, likely this is likely Alzheimer's disease.
Mhm.
But the other forms of dementia out there that a lot of people have, and it's because of a family history, is vascular dementia. And
Mhm.
so vascular dementia is secondary to strokes. And so, of course, we know that if you have a history of high blood pressure or a history of high cholesterol in your family, that you are likely to have those things in your life and are at higher risk of having stroke. And so, those patients with vascular dementia can also have those similar things like Alzheimer's, but it presents in a different way.
Mhm.
Let's move to you referenced this earlier, Dr. Kim, and we're talking about sports. And this discussion comes about as a result of the recent behavior of the recently retired, or I'm sorry, recently fired Antonio Brown.
Yeah.
And some are wondering if his acting out is an early sign of CTE, or the brain injury as a result of head trauma, or is he just is he just not right?
So unfortunately, I think we won't know
Um,
because
yeah.
he has had several incidents of that with other teams. I think the
Hmm.
Steelers and there's one other team. Was it the 49ers?
It was.
And the Raiders as well.
And the Raiders. Okay, so he's had these episodes, that have outbursts and things like that. So either, I've thought about, okay, could this be some type of bipolar disorder? Could this
Mhm.
be some type of, because again, I mean, even though I'm a neurologist, our boards is under psychiatry, so we have to
Mhm.
know a little bit about psychiatry in order to diagnose some of our patients who come off as psychotic actually have neurological diseases, and so we have to treat them as psychiatric patients.
Sure.
So I've thought about that, like what type of mental disorder does he have, if he has one. It could be a personality disorder, or again, it could be CTE. And my husband and I actually talked about that. Could this be CTE?
And CTE, you won't find out, like you said, with Alzheimer's until after death, and then you
Yes,
do the brain biopsy.
yes,
And I think Dr. Cam and Sybil, I think it's a rare case, and you see a lot of rare cases. I'm sure Dr. Kim, it may be a combination of both.
Right.
He made, because he was off the rails prior to these things happening. Then took a very severe headshot, and now it's kind of ramped up to a whole nother level. Like when you hear him speak now, it's totally on another planet.
yeah, yeah.
Before you can understand him, now you can almost like not really understand him. I understand Kanye more than I understand that.
Well, you're further along than many of us, including Kim.
Oh well. But the thing is, even when you mention Kanye, we all know has some type of mental disorder. So I think, and he's admitted that he's has, some type of mental disorder. So I think that is probably what is going on. But like you said, it's a really good presumption is that it could be both. It could be both of those things happening.
Yeah.
And is there something we can do for our children? Or we just got a little bit of time. I'm going to ask in the next segment about this because I am concerned about children and neurology and things like that. Because we are seeing a lot of acting out and some things amongst our children that
Hmm.
I think we should be concerned about. But I'm no neurologist, but I will go to a neurologist and ask these questions. So
Okay.
just take a short break, and
Okay.
then we'll just, as Yolanda likes to say, let's just breathe, as she's our yogi, and then we will resume and we'll ask about what's really going on. That's usually our question of the day. But Dr. Kim, we want to talk to you, and especially in terms of your specialty.
Okay.
We are talking to Dr. Kim Johnson Hatchett, and our comedian extraordinaire is Rudy Rush. And as Dr. Kim, how can people reach you? You have a great website. How can people reach out and find out more about you?
Okay, so I have a website, drkimberlyjhatchett.com. And I'm also on Instagram at Dr. Kim Neurodoc, Neuro Doc, or you can just type my full name in, Kimberly Johnson Hatchett, and I'll come up on Instagram. I just joined Twitter. Twitter is wild. I was like, I'm just gonna
Oh
Where'd you
watch
get
yeah.
some
to
foods.
TikTok?
I'm on TikTok, and TikTok's wild, and I just joined that. So I'm on Instagram mostly, and I have, like I said, I have a website, and you can connect with me there. And I have a newsletter and a blog that I just am starting out on. So those are the things I'm doing. That's how they can connect with me.
Dr. Kim, you have a really interesting story. You fresh out of college, you did not go to medical school. This
No,
is your second career.
yes, yes. So my undergraduate degrees in finance and banking.
Of
Um,
course.
and I started out actually as a chemical engineering major and got done, and I can hear my kids in the background, so somebody might bust into the room here any
That's
second.
okay.
Um, I started off in chemical engineering and got done with calculus 3 and realized the only thing I liked about engineering was math. And
Mm.
so I thought, I can't do this. Um, and I talked to one of our counselors when it was like Mr. Wine. He was the one of the only black counselors at the University of Missouri. And he was like, young lady, you like math? Finance. We're gonna put you in this finance group. And so he put me into finance school, and a couple of years later, I had a degree in finance and banking. And I really didn't know what to do with that. I didn't want to work on Wall Street. I didn't want to do, like Charles Schwab or anything like that.
Mhm.
And I thought, I know how to sell. I know how to present things. I like to present. So I got a job selling elevator maintenance,
Mm.
and I worked for Otis, the big one.
Yeah.
Yeah.
And it was a great job. I traveled, and actually, my first husband, he traveled. Both of us were traveling. That's probably why we stayed married as long as we did, um, because we weren't around each other that much. But then I got the bug of being a pharmaceutical sales rep, and that's what piqued my interest in science.
Mm.
And I realized I had the aptitude to really, truly understand the
Mm.
pathology of why these patients needed this medication. And that intrigued me more than the medication, was understanding the pathology behind it, right?
Mhm.
At the same time, my marriage fell apart, and I thought, you know what? I have nobody to answer to anymore. What am I going to do with the rest of my life? And I was
Wow.
like, you know what? This is what I'm supposed to be doing. And I thought back in high school, I was in this like 6-year med program
Mhm.
in UMKC. I had done like this summer scholars program. So I had gone down that thought for a hot second, and then, came back to reality and thought, oh, I'll do business, or I'll do engineering, I'll do that. I didn't even think that medicine was an option for me. But then I met all these women who are physicians in my life in St. Louis that so happened to, just like the perfect storm happened, and they ended up getting me the tools that I needed. And a friend of mine came back into my life, my friend Contessa. She and I
Dr.
grew up together. She was in Dr. Contessa. She was in St. Louis finishing up medical school. And I ran into her and told her what I was thinking about doing. And she said, well, of course you can do that. Of course.
Mhm.
And it was like not even a question about, okay, this is what you're going to do. This is how you're going to get in. And, it wasn't easy. By any means was it easy, but it is what it is. It came out okay.
I have one question. As a medical professional, in your personal, opinion,
Okay.
would you have a problem with us cloning you? Because I'm struggling out here. I need a Dr. Kim in my life. These women ain't smart. They don't cook or nothing, doctor. You done made children. You got 4, 5 careers. Come on, help me out. Give me a piece of hair. That's all I need.
That's all it needs.
That's all you need, huh? Some
That's
saliva
it.
and some hair.
That's it. Oh my gosh.
You have a fascinating story. I think that it's one that we can all learn from,
Yes.
as well as your medical intellect here. And I do first. I also want to thank Dr. Contessa Metcalf, who has been our conduit to meet you and connected us together. So, and she has been a really important part as we are putting together Check In and Check Up for Your Health, and made this connection with us. And so I really appreciate that. Also, as a result of our partnership with the American Heart Association, we've learned about a number of issues, including cardiovascular disease. And so, and you talked about about strokes and what kind of effect that can have on your brain. What do we need to know about the effect on the brain as a result of something like a stroke, and how varying is that?
Okay, that's a really good question. And so the the good and bad part about strokes is that they can be silent or
Mm-hmm.
they can be devastating. But strokes normally, unlike heart attacks, don't kill you. They leave you neurologically devastated, right? They're the one of the
Yep.
number one reasons why people live with disability in this country is post stroke.
Mm.
Mm.
So, you can have it. The way that you want to know that, or what you want to signal that you're having a stroke, is that there's been a sudden loss of something, a sudden loss. So if you have a sudden loss of sensation on one side of your face, just sensation, that could be a stroke. It's if you suddenly can't use your hand. You can move your hand, but you can't make it pick up a pen. You can't make it do things like you know. If that happens suddenly, that's a portion of your brain that could have a stroke. So it's a loss of blood flow to a certain portion of the brain that causes a loss of function in your body.
Mm.
Wow. And that is so that connection that between our brain and the motor functions of our body are usually affected by this. And is that what you see in the brain?
Well, not just the motor function, but your sensation, your
Mm-hmm.
vision,
Oh, sure.
your taste, your movement. Like, so you might be able to move, but you can't coordinate things.
Mm-hmm.
Talking, being able to form sentences. There's certain parts of the brain where in a very common portion of the brain that can have a stroke, can leave you being able to understand what people are saying to you, but not being able to speak back to them.
Mm.
And it causes a type of thing called aphasia, meaning
Mm-hmm.
lack of speech. So it's interesting, like it's fascinating all the different things and the different syndromes that are out there because of different types of strokes that people have had.
When you were in medical school, I mean, when like you were in college and you had an aptitude for math and things like that. But when you got to medical school, what was it about neurology that attracted you?
So when I was starting off in medical school, I thought that I wanted to do was be a surgeon, and I
Mm-hmm.
thought, okay, I'll do surgery, and I actually wanted to be a vascular surgeon.
Mm.
And vascular surgeons are people who put stents in arteries in order to restore blood flow to different parts of the body. So they put stents in all over the body. And I met a woman who was a surgeon, and she said, if you find something you love more than this, then do that. And my next rotation was neurology. And I had patients who were having strokes and some that had devastating strokes. And I saw how not only did the stroke devastate them, but their attitude towards their disability disabled them.
Mm.
Mm.
And I saw the variation of the diseases that affect that the nerves affect. And I thought, this is it. I love it. I love the fact that you can pinpoint and localize what we call in neurology is localizing a lesion. I can localize exactly what's happening to you. You have a foot drop, I can say, okay, your foot's dropping when you walk, this is where the lesion's at.
Mm.
Or you have this type of headache and you have this type of vision change, I can localize where in the optic nerve that lesion's at. So
Mm.
it's one of those, it's a puzzle, and it's just so fascinating to be able to. And I look at people, sometimes my husband will be like, stop it, because I'll look at people and I'm like, that person has this and this, and look at their trimmer and look at this, and he's like, please stop staring at that person. And so you're gonna get us into a fight. So yeah, but it's hard to turn off because it's you see it so much and you can see it in so many different people. And none of us are perfect.
Mhm.
And so all of us have some type of quirk or some type of something that's going on with us that you can localize their lesions.
So, Rudy, I want you to talk about, because you mentioned about having some concerns, and I want to talk about the effects of things on adults as well as children. So what would you like to ask the doctor?
No, honestly, as a comedian, we joke around a lot, but we definitely live a high stress life with
Hmm.
travel and especially with everything going on with COVID and all the restrictions. But I myself have a history of high blood pressure in my family. I've actually been diagnosed myself. So my thing is, I didn't want to go the route of taking pills constantly. So I tried to go more holistic and
Okay.
eating, changing my eating, working out, losing like over 30 pounds, which I never was heavy before, but because of COVID, I ate a lot. So I thought that's just something that brought on the high blood pressure.
Okay.
So, like someone who is close to 50, I'm 48 now, like what are some of the natural things? Because I'm not trying to be negative towards doctors like yourself, but one of the things we say outside of the doctor's office, like, ain't no doctor gonna prescribe no juice and stuff. They always gonna give you a pill, but are there some natural things that can keep your blood pressure at a certain level unless it's totally so high that you have to use medicine?
Well, so I think, thinking about from an evolutionary standpoint, when you look at those of us who are here who are not immigrants, we're here because of, slavery.
Mm,
And our ancestors survived that passage. Our ancestors survived that passage with very little food, very little water, and very little salt. So we're salt
mm,
retainers by ancestry.
Mm,
Okay. So the typical American diet has what? A lot of salt in it. So that's one of the reasons why it disproportionately affects African Americans, high blood pressure does, because we are salt retainers. So our salt in our diet needs to be minimal,
mm,
and be able to season with other things. So eating a very holistic diet, whole foods, lots of fruits and vegetables, exercise, doing 30 to 45 minutes every single day is what your goal should be, of some form of exercise. And then weight bearing exercises should be at least 50% of your exercise routine. So
mm,
lifting weights, things like that.
yeah.
But then also incorporating things like meditation and journaling and understanding what is stressing you out and dealing with that stress. Because I think that's another issue that a lot of us have, is that we have stress, but we don't deal with the reason why we have
mhm,
stress. And we just turn to food or turn to whatever, to kind of, medicate with those things versus handling tackling the big issue that's stressing us out. So those are some of the things that you can do. And I do tell my patients that. The reality is, though, most patients don't do those things. Like, you
Mm,
tell them to lose 10% of their body weight. And truly, 10% is all most people need to do in order to make a big difference in their blood pressure. Just
mm,
10%. And they don't do it. They'll come back 10% bigger. And you're
mhm.
like, okay, well, here's your medication,
Right.
because I can tell that I've got to do something. I can't let you have a stroke or a heart attack. I've got to take care of it in some kind of way. And I'm the same way. I have a family history of high blood pressure. I have high blood pressure. I do take medication for it, but I also exercise like a fiend. I love my Peloton. And I do what I need to do to try and I'm trying to release my stress and get things better. But I also check my blood pressure on a regular basis at home just to make sure that my numbers look good.
I'm gonna ask our audience. I know we have some questions, and so if we can go to some of those, that would be great. This is really this is good stuff here. Okay, here we go. Kyrie is on Facebook and is asking, "What are your thoughts about potential new Alzheimer's medications?"
So we have just learned about those. There's some new medications out there, that are, because previously the Alzheimer's disease medications we had, either they didn't necessarily give you things back. They kind of slowed down the progression of the
Mm,
disease.
mm,
And so these new medications are hopefully going to allow you to not only slow down, but hopefully regain some of these things back. But the
mm,
issue with Alzheimer's disease is that it's a buildup of plaque. And so when we think about what plaque is, it's a lifestyle pathology, right? Because plaque builds up in your arteries, it builds up in your in and causes heart attack, it causes stroke. but it also is a certain type of plaque that builds up that causes or increases your risk of getting Alzheimer's disease. So we know we've noticed that patients who have dementia or Alzheimer's disease who exercise, their symptoms actually get better as well. So the medications, I think, will be a game changer. It's a matter of getting those medications out and being on formulary and allowing them to be prescribed. But it's only going to be for certain types of patients, and it's not going to be for the garden variety dementia patient.
Is it just me, or are some of the effects of taking a drug worse than what you're actually going through or what you're trying to stop, the eradication of something in your body? And, when I watch these commercials with the drugs, and it's like, well, if you get this, this, then see your doctor after you're taking this
Yeah.
this medication.
Well, and the thing is, if you look at any medication, aspirin, Tylenol,
Yeah.
all those things, when you look back in the day when they would, when Tylenol wasn't a over-the-counter medication, those commercials said the same thing about Tylenol.
That's true.
So it's any medication that is a pharmaceutical is going to have side effects. And that's just, it is,
But Doc, you have to admit, it's kind of scary to be like, hey, listen, my stomach feels great, but I'm about to go kill myself. Like, I'm like, my God, like what's going on? Like suicidal. That's the biggest thing. Suicidal thoughts. Yeah.
Yeah. Well, I mean, that's, and what's interesting is that some of the antidepressant drugs can cause suicidal thoughts. And so it's a kind of a catch-22.
Yeah.
And so there's another question on there.
Yes,
I see.
Leroy Slater Jr. is on Facebook. He's asking thoughts about CBD or medical marijuana as an alternative medication.
So we are learning more and more about CBD and medical marijuana. And what's interesting is I just read an article actually yesterday or day before yesterday about CBD and COVID-19. And it brought up that they were in the lab, CBD actually killed the COVID-19 virus. And so it was an interesting article talking about that. And of course, they said further study needs to be done. But what I found is that a lot of my patients who have neurological pain, a lot of my patients who have migraines, some of my patients, some of the younger patients who have really poorly controlled seizures have found that medical marijuana has helped them.
Right.
They're doing more and more studies now that it's becoming more and more legal in different states. So that's I think is going to benefit. It's going to be a real benefit to our medical management.
I hope they
Can
don't
I
meet.
ask? I'm sorry, Rudy. Go ahead.
I said I hope they don't meet my uncle because he's been smoking crack for 30 years. He healthy as the border. I'm like, oh my God.
Oh God. Thank you, Dr. Kim.
I'm sorry, Dr. Kim. That dude's got 18 lives. I'm sorry.
Dr. Kim, let me ask you about children. And do you treat children as a result of behavioral issues? Or I know of a case, and I can't go. I'm not a physician, so I can't tell you all the details. But there are a number of children who just are having random anxiety, or they can't control their thoughts and their behaviors and acting out, that kind of thing. Is that a part of your practice?
No, it's not. So that would be a child neurologist or, a pediatric neurologist.
Okay.
But I have done some training. We had to do some training in that. And so those like the acting out, the ADHD, all of those things are more on the psychiatric end of the field. And you do see that more and more. And I think it's more exemplified now because of what we've been through these past 2 years and kids having to be at home, not being able to be in a structured environment, the way that school is structured. I mean, whether kids like it or not, they need the structure. And not having that structure or having that taken away has allowed the manifestation of a lot of these neurological and psychological diseases that these kids have been dealing with. So I think that's the reason why we're seeing it more and more is because of the disconnect that's been happening over these past few years.
And a lot of answers that previously people have been saying, well, they need to go on some sort of drug and some sort of medication in order to cure this, or therapy, is probably the initial
Hmm.
suggestion but it just breaks my heart, that kids feel so out of control, and
Hmm. Hmm.
it's you just want to do something to help them. But then there are adults like Rudy that are a little out of control too, and you want to do something to help them as well.
Well,
That's why Rudy's here today.
you know what? I might have had ADHD, but I got a lot of whipping, so that you can't do that no more. So it worked back in the 80s.
An 80s baby. It's nothing
That's
like you
right.
guys. Dr. Kim, I want to thank you, and I want people to keep asking the questions, but I also want to give you to offer you an invitation to come back again, because I don't think we've even
Okay.
begun to scratch the surface, and I think you have you have so much life experience as well as medical experience in all of this. I love talking to you, and I think this has been very good for our audience as well as for the two of us who are sitting right here with you.
Yes.
Let's just take a quick second and take another breath, and we're going to wrap this up. So we'll breathe, and we will remind people that we are sitting here with the wonderful Dr. Kim Johnson Hatchett. Our comedian today is Rudy Rush, who has just brought so much to the conversation as well. And as we wrap this up, I do have, we just like to end on a lighter note. And often we have questions of the day. And so asking both of you, and I think I know your answer to this, Rudy, but what is the kindest thing you think we can do for ourselves?
Wow. Uh, Me first?
Well, yeah, because we'll end with Dr.
No,
Kim.
you know what? The kindest thing we could do for ourselves. I recently have done some therapy. Shout out to Miss Cynthia Johnson, who's my therapist. And I feel like, therapists, they play a role in helping you. They don't know the answers, but they can help you find them. So I've done a lot of processing. A lot of things have happened with my children, my career, and through COVID, I've become a better person, but only because I went to find some answers that happened way, way back in my childhood. So I think that's the kindest thing you can do to yourself, is get to learn yourself and find out more to make you a better person moving forward.
And I thought you were going to say buy tickets to your next comedy show. Look at
Oh,
look at
wait a
this.
minute. I'm going to be in Philadelphia next week, the 3rd through the 5th with Bill Bellamy. Come check me out at Philadelphia's Punchline. Yeah, that's where I'll be. Thank you.
And don't forget to leave tickets for Dr. Kim next time you go to Missouri, to St. Louis.
Absolutely.
Or Kansas City, which is where
Kansas
I'm at.
City. Right.
Yes.
Okay.
Or St. Louis. I can go to St. Louis.
I've been to Stanford's out there. Yeah.
All right.
So, Dr. Kim, what about you? What's the kindest thing we can do, the best thing we can do to help ourselves these days?
It's so interesting that Rudy said that about the understanding and finding out who you were, and kind of just delving into those things. And I was going to say, trust yourself. And that's one of the things that I think about a lot, is learning how to trust who I am and trust that I'm going to do the best thing for myself. I think a lot of people run around and don't really truly, they say they don't trust anybody, but that anybody even includes themselves. They don't even trust themselves. So I think that's one of the kindest things that we can do, is trust ourselves, trust that we've made it through the worst days of our life,
Mm.
because you're here, you've made it
Mhm.
through the worst. And that, by understanding and analyzing those things, you can build a better future. And you have the power to do it only if you trust yourself.
Mm.
I agree. I think you guys have given great answers. I feel like, I feel a little selfish in saying that. I just think that we just need to be kinder to ourselves. I think that um I know I feel like I'm very hard on myself in trying to do too much and trying
Hmm.
to accomplish a lot in one day. And I'm very, very tough on myself. But I think that sometimes you just have to be a little more gentle with yourself, as you are with others. I mean,
Yeah,
you're your toughest critic, and yet, you gotta, kind of center yourself and take it easy on yourself, as the song used to go.
Yeah.
that's true. That's true.
Dr. Kim, I want to thank you so much for this. Like I said, I hope that you will come back, and that I know that we still have a lot of people with questions. And as I said, this is a part of our check in and check up for your health. It is going to be a regular part of our weeks on our YouTube and Facebook live shows, as well as what you hear on Sirius XM. And this is going to be on our Thursdays. And Rudy, I would like for you to come back too, because I think that we can all just gather so much from just this short period of time that we have been able to just kind of sit at your feet, Dr. Kim, and get this great
Yeah.
knowledge and information. I really am very, very grateful for this. And so
Well,
please
thank
come
you for
back.
having me. Oh, I
Once
will,
again,
definitely.
how can people get in touch with you?
Again, so you can come to my website, drkimberlyjhatchett.com, and you can also go to my Instagram page. It's at Dr. Kim Neurodoc, Neuro doc, or just type in Kimberly Johnson Hatchett on Instagram, and my page will pop up. I'm also on Twitter. I tweet very little, but I'm on there. And you can get a hold of me through there as well. So yeah, so those three places.
And Doc, if you see any messages in your DM from Rudy Rush, just ignore it, okay? just let it slide. Just delete it.
Okay.
That kind of patient you don't want to deal with, Doc. I don't think. One thing that I should, we are going to continue this series every Thursday, and a part of check in and check out for your health is going to see the doctor. That is a very important part of this. And as I said, we want to thank Dr. Contessa Metcalf for connecting us with Dr. Kim Johnson Hatchett, as well as going further. Hopefully she will be a part of these discussions as well. She's just such a busy lady,
Yes.
with the regular medical practice, raising a family like you, doctor, and, being a TV star on Married to Medicine. So, but we want to thank her as well. And before we close, every day we end with Yogi's Jewel. And this is our daily inspiration. And today is situations and circumstances will surely change. Good friends will remain. And that's a good part of our betterment too. I dare say. So thank you all so very much. It's been great. And Dr. Kim, go forth and continue to share your brilliance with others. We thank you so much for sharing your time with us.
All right. Thank you so much.
Rudy,